channel. This is Dr. Victoria Givens, your board-certified facial plastic surgeon and owner of Givens Facial Plastic Surgery in Austin, Texas. Today I'm talking about the earlobes, why they stretch and elongate, and how to fix them. So stay tuned to find out everything you need to know. Don't forget to hit that subscribe button and like below. Let's get going. All right, here we go with the topic of the day, earlobe reduction. Do earlobes get bigger as you age? Yes, they unfortunately do. While bones typically stop growing after puberty, cartilage, which makes up the upper and mid portions of your ear, continues to grow. In addition, the earlobes elongate from gravity, making the ears look stretched and large. Can stretched, thin, or elongated earlobes shrink? The short answer is no. Overly long, thin, or stretched earlobes require a surgical earlobe reduction in order to obtain a naturally youthful result. Unfortunately, no amount of time alone will make the earlobe shrink back to where they once hung. How is an earlobe reduction performed? An earlobe reduction is a cosmetic procedure that reduces the overall size of the earlobes. This procedure is performed using local anesthesia within an hour in the office or in the operating room. Excess skin and distorted tissue is removed, and the sutures are placed to reshape and secure the earlobes for a naturally refreshed appearance. The sutures will remain in place for 1 week and are removed quickly in the office. So who's a good candidate for an earlobe reduction? Well, patients both young and more mature are candidates for earlobe restoration treatment. If you have genetically or age-related changes, including elongated, misshapen, stretched, overly large, or thick earlobes, you're an excellent candidate for this life-changing procedure. Patients with a history of keloids, hypertrophic, or abnormal scarring are not candidates for this procedure. Does an earlobe reduction leave a scar? Now, I tell all of my patients that no matter the procedure, if there is a cut made to the skin or tissues, there will always be a risk of a scar. However, it is the visibility of the scar that matters. When an earlobe reduction is performed, the sutures are placed along the bottom of the earlobe, which hides the scar visibility extremely well. If you have any doubts, just take a look at my online gallery of before and after photos on my website, www.givensmd.com. What is recovery like after an earlobe reduction? You are able to drive home after the procedure. You may take a shower later that evening and get the sutures wet. Just make sure to pat the area dry gently after and follow your home care instructions. It is important not to submerge the sutures in a bathtub or hot tub, and you must avoid lake water for at least a week after reduction to avoid infection and bacteria accumulation. Exercise may be performed during your recovery, but you should be mindful not to pull or rub your newly repaired earlobes while the sutures are in place. What if you have torn or split earlobes as well as long earlobes? Great question. So you are in luck. An earlobe reduction can be performed at the same time as an earlobe repair in the majority of cases. Remember, a reduction is making the earlobe smaller, while a repair is closing a tear within the earlobe. Often, a reduction will require excision of a current earlobe piercing, depending on where it's located. Whether you desire an earlobe repair or require an earlobe repair with a reduction, it can definitely be done. When can reduced and repaired earlobes be re-pierced? One of my most common questions. Re-piercing a repaired or reduced earlobe can take place 4 to 6 weeks post-procedure. This allows adequate healing time and strength of the newly contoured area. In addition, repaired and reduced earlobes cannot be pierced within a healed incision, as the strength of the scar will never be the same as unrepaired skin, no matter the length of time post-treatment. Now, if you found this helpful, I encourage you to watch my other videos on earlobe repair treatment and recovery, as well as earlobe piercing. And as always, we know that personal transformation is one of life's most meaningful journeys, and Givens Facial Plastic Surgery offers a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those of you who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I'll see you soon.